before. We think that after you've seen this informative and comprehensive look at CardioSim 7, you'll understand why so many institutions of medical learning place their trust in our products. If you already use CardioSim, you'll see why our newest version is a must-have. If you're not already a user of CardioSim, we think you'll soon want to be. Let's get started. In their landmark paper comparing cardiac auscultatory skills published in the Journal of the American Medical Association, Mangione and Neiman conclude that internal medicine and family practice trainees had a disturbingly low identification rate for 12 important and commonly encountered cardiac events. This study suggests a need to improve the teaching and assessment of cardiac auscultation during generalist training. To overcome these deficiencies in auscultation training, Cardionics has developed a series of affordable instruments that together represent the Cardionics Auscultation Proficiency System. This system consists of CardioSim 7 Digital Heart Sound Teaching System, Auditorium or Classroom Infrared Sound Systems, Hartman Infrared Headphones, SAM, the Student Auscultation Mannequin, Simulscope Bedside Auscultation System, Student Self-Teaching System Auscultation and Evaluation Program, and Interactive CD-ROM with quiz for individual student use. The cornerstone of the Cardionics Auscultation Proficiency System is the CardioSim 7 Digital Heart Sound Teaching System. This new teaching instrument is available as a portable model with laptop computer or cabinet model. The portable CardioSim and laptop fit conveniently into this small carrying case, making it easy to share among multiple teaching environments. The CardioSim cabinet model is housed in a strong, lightweight cabinet with a locking door. The door is removable for easy access to the instruments. Now that you've seen the heart of the CardioSim 7 platform, let's see some of its basic features and functions in action. At its core, the CardioSim recreates realistic heart and lung sounds with sophisticated manipulation capabilities. CardioSim divides each sound into its key elements. Let's illustrate this with the sound of mitral stenosis and regurgitation. We will start with an S1 and S2. Note that on the screen is a phonocardiogram and ECG for timing purposes. Now, let's add an accentuated S1 with an opening snap. You can both hear and see this sound. Next, we will add a mid-diastolic murmur. If you wish to increase or decrease the intensity, you can easily do so with a mouse click or up and down control buttons. Now, we will add a presystolic accentuation. This is mitral stenosis at 75 beats per minute. If you wish to increase the rate, you can make simple adjustments of 5 beats per minute or major increases as shown. The rate is now 125 beats per minute. Any rate within the physiological range is possible, even for veterinarian sounds. Some heart sounds are affected by respiration and present a diagnostic challenge. One of the key benefits of the CardioSim 7 is that in addition to heart sounds, breath sounds are also reproduced in a realistic and sophisticated fashion. The sound you are now hearing is a physiological split of the second heart sound with respiration. Note how the split increases during inspiration and comes together during expiration. The blue trace on the third channel depicts respiration with an upward deflection for inspiration and downward for expiration. The sound now on the screen is mitral valve prolapse. We have removed the murmur and now are showing only the ejection click. If you wish to move the click to late systole to show the effect of squatting, it can be done with a single keystroke. All sounds, simulated, real, or your patient's, are assigned a number. They can be played by just double-clicking on the sound in the menu. The menu consists of sounds to illustrate timing, sounds for comparison of events such as the difference between an S2 split, an S3 or opening snap, and sounds of specific clinical conditions. There is also a complete section on pediatric sounds and a large library of real patient sounds. Now that we've reviewed the basic operating functions of the CardioSim unit and its ability to reproduce sophisticated heart and lung sounds, let's take a look at another key benefit provided by the CardioSim system to medical teaching professionals: the ability to easily organize sounds, animations, slides, and visuals into discrete lectures. One of the more difficult tasks in preparing a lesson plan and lecture with auscultatory content is the task of selecting, arranging, and packaging groups of sounds and simulations for student review in the classroom. As you'll see, the CardioSim offers the capability to deliver lectures in a whole new way. Let's take a look. When giving a lecture, the CardioSim sounds, images, and animations can be pre-programmed to save time and make the lecture flow smoothly. A lecture can consist of simulated real or patient sounds, images, and animations. Each instructor can have up to 8 lectures, with each lecture having up to 99 different sounds, images, and animations in any desired sequence. The instructor can set the heart rate and volume of each component in advance. Let's play a lecture that has been pre-programmed with simulated sounds, real sounds, patient-recorded sounds, images, and animations. Any slides that you as a user may have can be easily added to the images file, or you can also use PowerPoint presentation if desired. Cardionics is already the leading provider of intelligent auscultatory teaching technology. However, our focus on technical expertise and innovation is secondary to our belief that we must offer a compelling value to our teaching customers. Let's listen to what one of our current customers has to say about the CardioSim.
It's difficult to take second-year students who've just basically begun to think about listening to people and teach them how to listen to the heart. The beauty about the CardioSim patient simulator is that you can put in murmurs at various intensities and take them back out. You can add the gallop sounds and so forth so that they can actually control what they're hearing, and they begin to associate a mechanical event with an auscultatory event. They can both see on the screen and hear with their ears. And the combination of the ability to program their own heart sounds and to change them online is really unparalleled, and it's a tremendous teaching aid.
The ability of the CardioSim to recreate simple and complex heart and lung sounds represents only a part of its capability. After all, the mere ability to create these sounds provides limited value unless there is an efficient and effective way for students to hear them in a teaching environment. For this reason, we've developed another key component of the CardioSim system, the Auditorium Wireless Sound System. The Hartman infrared headphones are wireless and battery operated. They do not require charging and will operate for several years without the need for a replacement 9-volt battery. The Cardionics Auditorium Wireless Sound System can effectively broadcast to an auditorium of up to 500 students, offering great flexibility and convenience so that students can focus on what matters, hearing realistic heart sounds. To complete the classroom or auditorium teaching system, Cardionics has developed SAM, the Student Auscultation Mannequin. SAM teaches heart, breath, and bowel sounds by allowing students to listen to the sounds as they would with a real patient. In this way, students can learn the difference between sounds and how they vary by location. SAM has 4 sites for heart sounds, 8 for breath sounds, and 2 for bowel sounds. There is also a carotid bruit and a carotid pulse. The pulse is timed with the onset of systole. SAM can be used with the CardioSim or independently. Students can use their own stethoscopes to listen to SAM, or the simulscope can be used for group instruction. Breath sounds can be heard on either the right or left lung, and if desired, can be diminished on the lower lung. Volume on every sound can be controlled.